1 year ago this week, the public health department seemed barely a blip on the minds of 10 million Los Angeles County residents. Then along came the coronavirus. Los Angeles County residents and business owners spent their days learning what impact government officials could have on lives and livelihoods. Public Health Director Barbara Ferrer became a household name. We got to know Chief Science Officer Dr. Paul Simon, County Health Officer Dr. Muntu Davis and Department of Health Services Director Dr. Christina Ghaly, too. Their decisions brought the county together, helping residents to better understand the threat while watching daily the caseload, the hospitalization count and, sadly, the death toll. They also drove many of us apart, as restrictions on retail and restaurants frustrated business leaders and sent the economy spinning. The mission was clear, even if the waters to attain it were uncharted and murky. Slow the spread, educate, test and vaccinate the public, and save lives. They didn't act alone. Some decisions simply aligned with the federal government, more often with Governor Gavin Newsom and the state. Frustrated by business restrictions and declaring county leaders out of touch with the cities they serve, some local leaders considered breaking away. West Covina leaders, taking their latest steps toward creating their own public health department since deciding to break away from Los Angeles counties, will hold a public hearing on April 6 to discuss creating the position of healthcare officer to run the new operation. At the height of tensions, protesters demonstrated outside of Ferrer's home during the relentless winter surge. Similar signs of defiance played out beyond the gates of Mayor Eric Garcetti's home. Governor Gavin Newsom, meanwhile, faces a recall effort propelled at least in part in response to his pandemic-propelled policies. With the virus growth slowing, hope is strong that the worst is behind us. Businesses are inching toward wider reopening, museums are welcoming guests back inside, students are cautiously returning to campuses. Despite a fitful launch, the drive to vaccinate the county has picked up steam. But assessments of the response to the crisis, what did we learn? How should it change us? Are inevitable. And they will no doubt shape how leaders manage post-pandemic life and how leaders react to future emergencies. Critics argue that despite the strict public health measures, LA County still suffered severe losses. As of this week, more than 23,000 people have died from complications related to COVID-19. In December, the county's network of hospitals was nearly overrun. Those who support the public health measures counter by saying that saving any life was worth the effort. L. County, for its size and vast diversity, fared far better than experts would have otherwise predicted, according to Dr.